Thank you, Kevin. Kevin, we are grateful that you are here with us, and I can tell it has been quite the journey for you, and thank God for Guthrie. Thank God for their willingness to take care of you. Thank God for what Treasurer Garrity highlighted before, the fact that we have a trauma center in this community, and we just feel wonderful that you're here, and God bless you, and we wish you nothing but good health going forward. Thank you. Thank you. I want to thank Dr. Sabani for welcoming me here today, and I want you to know that I wanted to be here today because this is an example. With all the challenges we have in rural healthcare, this is an example of a healthcare system that works. And we want to hold Guthrie up as a model for the rest of our Commonwealth, especially our rural communities, on how to make it work. How to make it work to save lives like Kevin's when there's an acute issue. How to make it work when it means giving people the opportunity to work in a wonderful environment where you can not only make a great wage, but as we talked about before, you have a wonderful culture and a great place to be working with wonderful colleagues. We want this to be a model for how to deliver rural health care in a Commonwealth that is challenged right now in meeting our rural health care needs. So Doc, thank you for welcoming me here today, and thank you for being a great example that we're going to hold up to the rest of the Commonwealth. We appreciate you and all of your colleagues. I want to make special note of the presence of a friend of mine, and I know a friend to many of you because she literally lives in the neighborhood, and that is our state treasurer, who's also a trustee here, Stacey Garrity. You'll hear from her in a moment, but Madam Treasurer, I want to thank you for being with us today. I think it is also important to note the presence of your senator, Senator Yaw, and your representative, Tina Pickett. We've all worked together on a number of issues, and I know we live in some polarized times, but I hope you'll note that the fact that you've got a Democratic governor with a Republican senator and a Republican representative working together to address rural health care. I think that's something we should be proud of in Pennsylvania, that we can come together to get stuff done. I'm joined today by one member of my cabinet, Secretary Davis Jones, who leads the Department of Drug and Alcohol programs. Secretary Davis Jones has a unique initiative that has worked to recruit and retain the talent we need in the healthcare space. She'll speak about that in a moment, but it's a pleasure to have Secretary Davis Jones with us here in Sayre today. So thank you, Madam Secretary. We pride ourselves in Pennsylvania on coming together to solve big problems. I know that folks get frustrated sometimes when they see problems that seem to linger on and on and on. Here in our Commonwealth, we believe it is our job to find ways to come together around common sense ideas to deliver real results that make a difference in the lives of Pennsylvanians. We've done that together in so many different spaces, whether it's public safety or helping our seniors, just as two examples of where we've come together to manage to pass legislation that lifts everybody up in rural, urban, and suburban communities. I'm proud of the fact that we've been able to do that, but I'm also mindful that we've got a lot of other problems to solve, and rural health care is chief among them. We've got a strong foundation of cooperation and collaboration to build upon. We've got great examples like Guthrie who can help us find answers to these pressing problems that we see all across Pennsylvania. One of the biggest challenges I think we face as a Commonwealth is around workforce shortages. Now, I want to be really clear, workforce is different than employment. In fact, more people went to work in Pennsylvania today than at any other time in our nation's history. Our unemployment is at historic lows. That's really something we should be proud of today. But we have a responsibility to be focused on what the challenges are for tomorrow. And that's the issue of workforce that we are investing so much time and resources in to address workforce shortages in really critical sectors. About a month or so ago, I introduced my budget to the people of the Commonwealth. It's a budget that was introduced that is balanced, it makes critical investments, it cuts taxes, and it maintains a healthy reserve. And it's a budget that now goes to the members of the General Assembly for them to consider, for them to put their stamp on, for them to put their views and values on, and then eventually we'll come together and compromise and move our Commonwealth forward. One thing that is clear throughout my entire budget is that it places a special emphasis on workforce development, on making sure that we shore up those areas that are struggling without the necessary personnel. And one of those key areas that my budget invests in is on rural healthcare and making sure that we've got the personnel we need in our rural communities to keep people healthy and safe. That means we need more doctors and more nurses, more mental health professionals, more addiction specialists in our communities, especially our rural areas. Consider this for a moment. More than 850,000 Pennsylvanians, and there are 13 million Pennsylvanians, so we're talking about a big chunk, do not have enough healthcare providers in their communities. Senator Yaw mentioned in our meeting before, we have one county, Sullivan County, that doesn't even have a physician available for people in that community. And we're seeing a real challenge all across Pennsylvania that is distinct to rural communities. Consider this for a moment. In our urban areas, you have one practitioner for every 222 residents, pretty decent ratio. You go out in the rural areas, we have one primary care doc for every 522 residents. That's not okay. And when you factor into that, then in rural areas, it just takes longer to get places, and you've got fewer healthcare providers, primary care docs. That is a real problem. Nursing is another area where we have a real challenge. Statewide, 14% of our, we have a 14% nursing job vacancy rate, 14%. That is one, and in rural communities, the percentage of unfilled nursing jobs is 26%. So 1 out of every 4 nursing jobs is vacant, goes unfilled in our rural communities. The good news is Guthrie's got a plan that we want to emulate across the Commonwealth to make that better. If we do not act now, those trends are only getting worse. By 2026, if we do nothing, we are expecting to have 20,000 nursing vacancies across Pennsylvania. In that same year, Pennsylvania is projected to have a shortfall of more than 6,000 mental health and behavioral health care professionals. Now is the moment to take action. Goes back to what I said a moment ago. This is not an employment challenge. This is a workforce challenge. And it's on us to plan for a future right now. And so that's why my budget takes concrete steps to recruit more healthcare providers and incentivize them to work in great communities like Sayre all across Pennsylvania to ensure that every Pennsylvanian, no matter their zip code, has access to healthcare professionals in the communities that they love to live, work, and play in. I think it is not new to us in Pennsylvania to address workforce challenges. We knew, for example, that we didn't have enough state troopers. We invested in them, and we've already increased our complement by 800. We knew we didn't have enough municipal police officers. We invested in them through our budget process, and we've added 700 more. You might ask, why is this guy talking about policing when we're supposed to talk about rural health care? It's an example of how we've come together with financial incentives to increase the personnel we need to keep us safe. Here's another shortage we face. We don't have enough teachers making their way into the classrooms. Yet we came together on a bipartisan basis and passed a teacher stipend initiative, student teacher stipend initiative, to pay student teachers to get them in the classrooms to educate our kids. And we're beginning to see the trend lines change, bringing more teachers into the classrooms. I cite that as 2 examples of where we've come together and made progress. Now the next challenge is rural health care, coming together to make critical investments to do that. And we have models to build upon. I want to talk about what Secretary Davis-Jones has done. Under her leadership, she has worked to offset student loan debt for 675 trained substance use disorder treatment professionals in Pennsylvania, and then after paying off their student loans, incentivize them to go work in communities that did not have enough professionals. You'll hear more from Secretary Davis-Jones about this work. But here's the thing, I'm a common sense guy. If we're doing something that's actually working, getting more cops on the beat, more teachers in our classrooms, more substance use disorder professionals in our communities to treat people who are battling the disease of addiction, We need to do more of that. We need to build on those initiatives that work, particularly initiatives that don't cost a lot, but have a real impact on our lives and our communities that are struggling. So this budget takes that successful model from DDAP and builds up on it. I'm proposing 3 concrete steps to address workforce shortages, especially in our rural communities. First, we expand the loan repayment model to apply not just to substance use disorder treatment professionals, but all mental health and behavioral health professionals across Pennsylvania. Second, my budget creates a new loan repayment program specifically focused on healthcare professionals who take jobs in rural communities. I want to build a stronger pipeline of healthcare professionals to places like Bradford County, all across the northern tier and other rural areas that are struggling. My budget does that by paying off the student loan debt for doctors who agree to serve at least 2 years in one of those rural communities. Third, my budget strengthens the partnerships between hospitals and nurse education programs that guarantee nursing students jobs once they graduate. Let me explain briefly how this works. Hospitals all know they need more nurses. You're going to hear about that in a moment. So they partner with local nurse education programs to offer guaranteed job placement programs to nursing students after they graduate. The hospitals get a guaranteed workforce trained nurse to fill a job, and that nurse gets an opportunity to fulfill his or her dream to be a nurse and help their communities. Nursing students have the peace of mind knowing that they're going to have a place to land at a wonderful salary, and they get help covering their tuition in the meantime. Altogether, these components of my budget will create a stronger pipeline of well-trained nurses taking jobs in local communities. Guthrie is already doing this work, and I know that public sector help is important to them, but they're also managing to do this on their own, which is really admirable. We want to take this Guthrie model and expand it across Pennsylvania to do more. I think this is a hospital that has obviously a very long history, more than a century old, one that has had to change and adapt over many years, and a lot of change here in the northern tier. And yet, the spirit of innovation lives on at this wonderful healthcare institution. And it's that spirit of innovation we need to drive change in Pennsylvania and challenge us as policymakers and leaders in the Commonwealth to do even more. So we are here to be partners to you at Guthrie and here to lift up the example that you're setting for the rest of our Commonwealth. Listen, healthcare staffing shortages in rural areas is not unique to Pennsylvania. We see this all across the country. But I'll tell you something, here in Pennsylvania, we know how to come together and solve problems. And this is the next big problem we need to solve, and working together, I know that we can do that. Working together in a bipartisan manner, working together with the private sector, listening to healthcare leaders and experts like you have here, that's going to help us solve the problem and continue to get stuff done here in the Commonwealth of Pennsylvania. So I want to thank you all for being here today and giving me an opportunity to share my vision, and thank you for bringing me here today to educate me on the Guthrie Way so that we can continue to expand that across this Commonwealth.